Hi class, Dr. Jim here. In this lecture, we're going to continue on with the cardiovascular system, and now we're going to look at the heart in general. So the last lecture that you saw with the cardiovascular, I primarily stuck to just the blood and the parts of the blood. In this lecture, we're going to look at the heart itself, how to look at the heartbeat, what the heartbeat means, what blood pressure means, and then also look at some of the arteries and veins associated with that. And so we're going to talk a little bit more in depth about the main tissue of the cardiovascular system, or the main organs of the cardiovascular system, in this lecture. If you didn't see the lecture on the blood, I highly recommend going back and watching that one after you finish this one. But you don't need to watch the first one in order to understand this one if you didn't look at it yet. All right, so what we're looking at are what are the main parts of the heart and how does it function. We're going to talk about what is the heartbeat and how we measure it. Okay, what are the major blood vessels in the body and how do we measure blood pressure? Okay, and talking about blood pressure, and then we're going to talk a little bit about the major cardiovascular diseases that we should worry about. And so I'll give you a list of some of the diseases and talk about what these things are and find out what you can do about these things and kind of give you a little idea or heads up, because obviously heart disease is the #1 killer of both men and women in this country. And so when you get industrialized, you live longer, you have more problems with parts wearing out, and one of the things that can wear out is your heart, thinking about how much it beats throughout your lifetime. Okay, so let's start. And the first thing we're going to look at is the heart. And again, the heart is one of the first organs to develop as when we are growing as an embryo. So as an embryo, about the first 4 weeks of development, our heart begins to form. And what it does is it starts beating, and you can actually see on a very early ultrasound, if you do about 7-week ultrasound, you can actually see the heart pumping. And so that's one of the ways that they can see that the fetus or the embryo is actually surviving and doing pretty well, because you can actually see the heart pumping in that case. And so it's one of the first things that actually develops. And again, once your heart stops, that's when death occurs, because you need the heart to pump blood to all the other parts of the body. So the heart is very important, and once that stops, that really brings a quick death to the rest of the body, because you can't move the oxygen and nutrients that need to go to those cells. Okay, you want to know the size of your heart? Make a fist and kind of look at it, and that's about the size, and it's kind of sits in the middle of your chest right here. It's not on one side or the right side, but it sits kind of right in the middle, and it's protected by the sternum, and it's about the size of your fist. Okay. The other thing is it weighs about 250 to 300 grams, so it's pretty good size. And again, how big you are determines. Now, if you are heavier or taller, your heart's going to be bigger than someone that's smaller and shorter, because obviously the heart's got to work harder to pump the blood to the top of your head and to the bottom of your feet. And so that's an important trait to think about too. So the bigger you are, the larger your heart's going to be. And it pumps about 7,000 liters of blood a day. Now, if you did see the blood video, you remember that I told you have about 5.5 liters of blood in your body in men and about 4.5 liters in women. So 7,000 liters means you're constantly recycling your blood throughout the day, and your heart continues to beat even when you're asleep. So you think about 24 hours, that's 7,000 liters in every 24 hours. And so that's a lot of blood that it pumps through your heart. So you constantly are recycling your blood through again and again and again. Okay? And if you estimate how long you live, and so in the United States now, the average lifespan is about 76 to 78 years in both men. Men is a little younger than women, which is around 81 now. And you can average about 2.5 billion heartbeats through one lifetime. And so that's a lot of beating that takes place if you think about how many times your heart beats and how long that goes. And so in an average lifetime, that's about 2.5 billion times that it actually thumps. Okay, and so that's a lot of pumping that heart does. All right, so what are the parts of the heart? Well, the first part is the walls. And the walls, if you remember the tissues we talked about, that the tissue is a special kind of tissue called cardiac muscle. And cardiac muscle can be divided into 3 layers. We have the epicardium, the myocardium, and the endocardium. And you can kind of see by just the definition, or by the beginning of these words, you can kind of tell where these things are. The epicardium is on the outside, or the epi side of the heart. The myocardium is the thick middle, and then the endocardium is in the very inside where the blood is actually where it gets pumped. And so those are the three layers of the heart: epi, myo, and endo. Okay, you have two chambers. You have two atria on either side. You have the right and the left, and you have two ventricles, also right and to the left. The right side is responsible for bringing the blood into the heart from the veins, going into the right ventricle, which is smaller, and it pumps the blood to either the right or left lung. The blood comes back from the lungs through the veins, pumps into the left atrium, goes down, and then the left ventricle, if you can kind of see, is much more muscular than the right, because that has to do the pumping and pump it throughout the body. So think about the distance from the right ventricle to the lungs is not very far, so you don't need that much pumping to go on. However, the left, which is on the left side of their heart, is going to go and pump to your brain, to your feet, to your arms, and so that has to be a really strong size muscle. And so you can look at a lot of diagrams and you can tell which is the right and the left just based on the size or the thickness of the walls of the heart. So the left is going to be much thicker than the right because of the job it has to do. Okay? And then the valves. And so you have valves that open and close all the time in the heart. And so we do want you to know these things. And again, in the next slide, I'm going to talk about the tracing the blood through the heart. And so these are important. You have two sets of valves. You have the atrioventricular valves, or the AV valves. And this should make sense where you find these. Well, these are the valves that separate the atria from the ventricle. Okay, atrioventricular. And you have two of them. You have the tricuspid valve, which is found between the right atrium and the right ventricle, and so it has three walls that close up on it, and the bicuspid valve, which is in between the left atrium and the left ventricle. And again, this is the bicuspid because it has two walls. Sometimes you hear this as the mitral valve, so you might hear this called the mitral valve. And so, like, if you have a leaky mitral valve, that means the bicuspid valve is leaking, that it's not closing all the way, and you get blood leaking into it. The other two valves that you have are also found now in the ventricle. So this separates the ventricle from the vessels that pump the blood out. So you have the pulmonary, which is found in the right ventricle, that then leads out to the pulmonary artery. And then you have the aortic, which is at the sense of the aorta. And you can't really see it here. It's kind of sitting behind this guy here. And so it's behind here, pumps through the aorta, and then pumps the blood out. And so that's the semilunar valves. And they're called lunars because they're half moon. And so they kind of look like moons opening and closing. And you can kind of see it here, how they're kind of the crescent-shaped moon. And that's where they get their names from. Okay? So again, you're going to have to know those. So kind of get an idea of what those things are. And like I said, the other last thing is the pericardium, which is a membrane that surrounds the heart and protects the heart from the outside world. And so we'll talk a little bit more about that as well. Okay, so like I said before, you're going to be responsible for knowing the blood pathway through the heart. Okay, this is a great diagram here showing you through, and I'll take you step by step of what we expect you to know. If you were a blood cell traveling through the heart, how would you get through the heart? So the first thing you do is you come in, if you're a blood cell, into the heart from either the superior or inferior vena cava. So the superior is from the head, the inferior is from the feet. Okay, remember, superior from the top, inferior from the bottom. They enter into the right atrium. The right atrium is where the blood comes first. Okay, the blood then travels through the AV valve, the tricuspid valve, okay, into the right ventricle. And then once it goes in the right ventricle, it's going to pass through the semilunar valve of the pulmonary valve. Okay. It then leads out to the pulmonary arteries. Now these, even though they are blue, they are still arteries because they're moving blood away from the heart. So that's an important thing. Arteries always move blood away. Veins always bring blood to. And so in this case, they're called the pulmonary arteries. And even though they're blue, these are the only blue vein or blue arteries that you have. And that's because it's moving the blood from the right ventricle to the lungs. Okay, the blood goes to the lungs, okay, through the pulmonary vein, comes back from the lungs, and then goes into the pulmonary artery. And you can see the pulmonary artery over here, which is down here and down here, and these guys are now oxygenated. And these are the only two veins that you have that are oxygenated or look red because they have oxygenated blood from the lungs, and they go to the left ventricle. That's the next step. The left ventricle then pumps the blood through the AV valve or the bicuspid or mitral valve. The blood then enters into the left ventricle, and then once you get through the left ventricle, you go through the second semilunar vesicle, which is the aortic valve, and then finally out the aortic trunk, which is this big vessel here, and then the blood leads to the different parts. These guys go to the arms and the head, where the rest of the blood, the aorta, goes down through the body to the kidneys, to the liver, the digestive system, to the feet, and everywhere else in between. So what I would do is study this pathway so that you know and you feel comfortable with it, and just write it down and go through it and say, I'm a little blood vessel and I need to travel through the heart. How would I get through the heart? And this will be very important, because on the next test, we'll ask you a series of questions. How does a blood vessel, or how does a blood cell get through the heart? So make sure you understand that. And you'll see this also on the practice quizzes and things like this to help you study for these things in the future. Okay? And if you don't think this is mean and making you to learn this now, you're definitely going to have to learn an A&P. So you might as well get it out of the way now, and then you'll have it for A&P and you'll be ahead of the game. Okay? So the next thing, what is the heartbeat? Well, we actually have two different descriptions of the heartbeat. You have systole, which is the contraction of the heart. That's the beat, okay? And then you have dystole, which is basically the relaxation of the heart, okay? And so it squeezes and then releases, squeezes and releases, squeezes and releases, and that's your heartbeat. You have the two, the systole and the dystole, okay? Systole and dystole, and so they're both the contraction and relaxation of the heart. And you can kind of see here with the pictures. You squeeze the heart, and that gives you this wave, and then the release gives you this pause, okay, and the relaxation. And so that's what you're seeing. You might, if you listen to the heart through a stethoscope, you might hear the lub-dub, or if you're taking your pulse, the lub-dub is basically, the lub is when the ventricles contract and the AV valve closes. That's the loudest part. So what you're hearing is not the heart squeezing, but you're actually hearing the valves open and close. And so the lub is when it closes, the AV valve closes. So the arterioventricular valve here, the tricuspid and the bicuspid close. And then the dub is when they relax and the valves open back up again. Okay, and the semilunar valves actually close, and so you keep hearing these valves open and closing. And so that's the lub-dub sound. The sound is actually the valves and not the heart itself, and so you're hearing the valves open and closing all the time, and so that's the lub and the dub. Okay, so the lub is the AV valves, the tricuspid and bicuspid closing here. So here and here in both the atrium to the ventricle, and so those are closing while these open. And then the dub is basically when these valves close and these reopen again. And so it's the opening and closing of those valves that you're hearing. Okay. The beat supplies the blood moving through the arteries, and that beat is what you feel when you take your pulse. Okay. And then how you get the blood back is using your skeletal muscles. So the veins don't have the muscle to do it. And so your skeletal muscles are the ones that actually contract and push the blood back to the heart. And so moving is very good to get the blood back and the blood moving, because it pushes and forces the blood back to the heart. And so you're more efficient when you're moving your body and getting the blood back to your heart. All right, so that's the heartbeat. Now the other thing that's involved is the pacemaker. And I'm not going to spend too much time, but you have these various nodes, they're called, and that's basically these nerve endings that control the contraction of the heart. Okay, so you have this SA node that keeps the heartbeat regular. So this is the one that basically keeps it in check and making sure that you beat every so often. And then the AV node signals the ventricles contract. So that kind of keeps pace, and that's what is called your pacemaker. Okay, this is what basically tells your heart to beat all the time. And so it basically sends a shock to your heart, and it causes it to contract. So you get that nerve impulse, contract, and then release, contract, release, contract, release. And that's what these pacemakers are doing. They're causing the heart to contract and then release. And that's what's going on in these cases. Now, sometimes if your heart isn't working right, a lot of times what you'll do is you go to the hospital and they put all these little electrodes on you. And what they're doing is they're measuring the electrical output of your heart. And so they're looking at how your heart is functioning. So you get this little wave, and it's called the QRS wave a lot of times. And the QRS wave is basically measured by this ECG. And so it's recording the electrical changes of the heart. And so you get this wave. Typically what you can see is a little P wave is when the atrial actually contracts and forces blood into the ventricle. Then you get that strong contraction by the ventricle, and then which is the QRS wave, okay? And then once it releases, then you get this T wave, and that's the second part of the relaxation. So you get this wave that shows the quick contraction of the atria, then the strong contraction of the ventricle, and then the release. And that release is basically the part of the wave. And so they can tell if your heart isn't working right if you don't have this nice contraction, or they can see that it's skipping a beat or doing these different things by looking at the frequency of the wave and how big in magnitude this wave actually is. And so they can do a lot of different things by looking at these things, okay? And your pulse is the pressure waves generated during the ventricular contraction. And so what you feel when you measure your pulse down on your wrist is actually the ventricular contraction traveling through the muscle of the heart and then traveling into the muscle of the arteries. And so that's why you feel the pulse. In veins, you don't have that muscle, so you can't feel a pulse in your veins. You can only feel it in your arteries. And so that's how you know when you're on an artery versus a vein, because you can feel a pulse, okay? Because of muscular contractions that travel down the arteries, okay? Now the blood vessels, again, you have two types of main blood vessels. You have the arteries and you have the veins. Now remember, arteries take blood away from the heart. Veins always bring blood to the heart, okay? In between, you have this network of smaller vessels called capillaries. And again, you can break it down into atrials and venules, but I'm not going to ask you to know those things, but those are important. You know, those are part of the capillary bed. Again, this is when they get to be about 1 cell thick, and so that the oxygen can be diffused from the blood, and so then it travels back and then it works back. The one interesting thing is you can see how thick the arteries are, and again, they're very muscular, so they help continue the contraction of the heart to pump the blood away from the heart, whereas the veins have these little kind of trap doors in them. These trap doors are known as valves, and what they do is they open so the blood can come through, and then they close so that the blood can't return back. And so it's kind of that one-way only kind of thing, so that the blood can only go in one direction and force itself back to the heart. Because if you look, the size of the vein is much smaller than the size of the artery if you look at just the diameter itself. Okay, so those are the types of blood vessels. So remember, arteries move away from the heart, and these include things like the aorta, the pulmonary artery, which is the one that goes to the lungs, the carotid artery, which runs up to your head, the femoral artery, which actually runs down your legs, and then the brachial arteries, which run down your arms. Okay, so those are some of the main important arteries that you should know. Okay, veins always move blood back towards the heart, and these include major veins, including the vena cava. You have both the superior, which comes from the head, and the inferior, which comes from the trunk. You have the pulmonary, which again comes from the lungs. You have the jugular vein, which comes from the head, so that's the blood returning from the brain. You have the femoral, which again is in the legs, and then again the brachial vein, which is then in the arms. And again, you can break these down more, and if you do go on to A&P, you're going to have to learn even more major veins and arteries, but I just wanted to point out some major arteries and veins that you have to know. Now, and then again, the capillaries are also very important. Now, the other thing that I wanted to mention was the coronary arteries, and these are the arteries that supply the blood to the heart specifically. So the muscle doesn't get the blood from the inside, it actually gets it from the outside, and so these arteries actually come off the aorta, okay, and they run onto the heart, and this supplies the blood and the oxygen so that the pump of the heart pumps normally, okay? And so that's really important. So it supplies the heart with blood, okay? And if you have this thing called a myocardial infarction, it sounds like a funny word, but that's just another or important meaning heart attack. And so what that is basically that one of these vessels have become blocked. And so now blood is not reaching to the heart, and now heart muscle is starting to die because it's not getting enough blood. Okay, and then this would be a normal artery. This would be a narrowing of the arteries. So if you eat a lot of fatty foods and other things, you start developing these lipid plaques within the arteries. They get hard, and it gets much harder to pump the blood through. It also increases the blood pressure. Now, what happens if you have a heart attack? Well, the first thing you should do is always call 911. Don't wait. Don't drive yourself to the hospital, because you might be sitting in the waiting room having a massive heart attack, and you might die before you get a chance to be saved. If you have any signs or symptoms of a heart attack, call 911 right away. get the ambulance and they'll take you directly into the hospital. They'll get you in the gurney, they'll get you in the cath lab right away to see what's going on. Otherwise, if you drive yourself to the hospital, you might be sitting in the waiting room for a long time because they don't know that it's that serious. Okay, so whenever you have heart attack symptoms, don't hesitate, call 911. Don't go to the, don't go to the urgent care. Just go call 911 and get yourself to the hospital. Because what they can do is you can go right directly to a cath lab. And what a cath lab is essentially where they will use a dye. So they send a catheter that enters in through your groin region, and they send this catheter up. And what they do is they run it up the aorta. Okay, let me get my pointer here. Run it through the aorta, and they release this dye. And what this dye does is then releases this colored dye into the arteries. And what they can see is if an artery is blocked, so they know where the blockage is. And so they can say, okay, we can pinpoint where the heart attack is based on where the dye is not making it. And so what they can do then is then replace the catheter with another catheter that has a balloon on it, and this is called angioplasty, where they actually inflate a balloon and spread open the artery, and they leave this metal sheath, and what that does is keeps the artery open. And so this is known as angioplasty, and so this is basically using balloons to open the vessel. And so this is a common practice that they do to open the vessel. And so I know a lot about this is because my dad suffered a heart attack a couple of years ago, and he felt horrible. He called 911, went to the, they got him to the hospital, and within 30 minutes they had him on the catheter table, basically on the operating table, doing this procedure. He was awake during the whole procedure. They opened up his artery, and he said he felt almost like 100 times better in an instant, and that's because they opened the vessel. And so you would know right away if you're suffering a heart attack. You feel this incredible pressure on your chest. You feel the tingling in your arm, things like this that happen. This true signs and symptoms of a heart attack. So if you feel any of those things, do not hesitate. Get yourself to the hospital. Call 911 and do those things, okay? And they can do a lot of things that won't require massive surgery and opening your heart so that happens, because the longer you wait, the more likely you're going to have massive heart damage, and then that can lead to even more problems. Okay? So the last thing I want to talk a little bit about is blood pressure. And blood pressure is basically the amount of force your blood exerts against the walls and the blood vessels, okay? And so a lot of us have different stages of blood pressure, and so you should monitor your blood pressure and what's going on and that stuff. But basically, that's the force that it takes the blood, or the force that the blood is going through the blood vessels. So a normal blood pressure, you can see here, is in the range of 90 to 120 to 60 and 80, and that's normal blood pressure. Okay, you have two numbers. You have the systolic, which is basically the maximum ventricular contraction. That's the big number, okay? So that's the one that typically ranges between 90 and 120 for a normal blood pressure. Then you have the diastolic, which is the small number, okay, which is 60 to 80. So the normal blood pressure most people are shooting for is 120 over 80. That is a very normal blood pressure. However, some of you may have been diagnosed with high blood pressure, or what is called hypertension. And hypertension just means that your heart's pushing a lot harder than it has to, because it's either restricted, it's not working as well, or something's going on and it's forcing the blood through the vessels much harder. And so you can see the levels. So if you're at 140 over 90, you're at a pre-hypertension rate, and you might want to have monitoring going on. If you're at 160 over 100, you're at stage 1, and if you're over above, between 160 and 180 and 100 and 120, your heart is really pumping. And so you can probably feel it in your chest that heart is really pumping, and that is not a good thing. You want to get that blood pressure down, because the harder your heart has to work, the more likely it's going to fail. And so that's why it's important that you take care of yourself and lower that blood pressure if you can. So a lot of times culprits are like salt or high salty things, fatty foods, other things that raise the blood pressure. Raising the blood pressure is a bad thing. If you drink a lot of caffeine, that's another thing. Caffeine affects the heart and the fat and how hard the heart pumps. And so sometimes you have one of those wonderful coffee drinks at Starbucks, and the next thing you do is you feel your heart and it feels like it's pounding out of your chest. It's because the caffeine stimulates that heart muscle to contract faster and pump that blood even harder, so you feel it. And so You might want to avoid the caffeine if you feel that way after the fact. And so you want to be very careful in doing those things because people have been known. Now, I'm not saying that you're going to go drink one of those coffee drinks and you're going to have a heart attack, but if you constantly do that and you stress your heart out, you can lead yourself and cause heart failure to occur in those situations. And it's not unheard of that someone that drinks those big energy drinks with lots of caffeine can give themselves a heart attack by doing too many of those things. So just be careful out there in how much you take. Okay. So how do you measure the or the blood pressure? And we're going to actually do this in the lab this week. We have it all automated for you. But a lot of you guys are going on in the medical field, and it's probably a good thing to learn how to measure the heart rate. And so we'll teach you this week how to do that and how you look at it. It involves a blood pressure cuff in which you squeeze, squeeze, squeeze over the blood pressure, then you release, and then you place the stethoscope underneath, listening to the vessel. And as soon as you hear the first start of the pulse, that's the top number. And as you continue to decrease the pressure until you stop hearing the pulse, that's the low number, and that's kind of how you measure it. And now most of these things are automated so that you put it on the person's arm, you can read the pressure, and you can see, you can get the top pressure and then the bottom pressure. And so you can kind of tell. And again, we're going to look at this week. Now, the last thing I want to talk about is a little bit about cardiovascular diseases. And the reason why I bring it up is because heart disease is the #1 leading cause of death in the United States. It's because we're an industrialized country, and now instead of worrying about different diseases like Ebola and other things like that, we worry about these things that typically kill us. We live a longer time and parts start to wear out. And so you can see the different risks, and I definitely would take a look and read these different things if you have a chance. But one of the things is hypertension, high blood pressure. The more your heart has to pump and work, the harder it's going to work, the more likely it's going to fail in the future. Okay, it's just like your car. The harder your engine has to work, especially in the winter, the more likely it's going to fail. And you don't want to do that to yourself. You don't do that to your car. Why do that to yourself? Okay, so that's #1. Another one is atherosclerosis. So it's a big, long word, hard to say, but that means basically the hardening of the arteries, okay? So you get fatty deposits in the arteries, and basically what they do is they start clogging the arteries. This leads to heart attacks and stroke and other things. So again, lowering the fat intake and also eating a good balanced diet helps, okay? Stroke is another cardiovascular disease. Instead of having a heart attack, a stroke is basically a brain attack. And so you hear a lot of information about those things. And again, that could be a blood clot, it could be a bleed out, a number of different things. And again, that's when the blood is not getting to the brain. Okay, another one we've talked about already is a heart attack. A heart attack is, again, blocking of one of the 2 main coronary arteries. You have blockages, it leads to heart damage, and eventually could lead to death if not treated properly or quickly. Okay, another one is called angina pectoris, and basically that's the pain. So it's not necessarily a heart attack, but it's when you feel pain in your chest. And that could be either due to a valve problem, that could be due to a tightening of the muscle itself. The muscle feels really tight and painful, so people describe that as a heart attack. But really it isn't a heart attack because the muscles aren't dying, but it is something where the muscles are tightening together, and so it can cause severe pain. And so it can be mistaken for a heart attack, and again, that could be something that, again, people relieve with medication and other things, but that's another symptom or sign that you should get to the doctor and see your doctor. If you feel pain in your chest, don't wait around for that. You go get it checked out and figure those things out. Okay? And so we've come to the end of this lecture. You've learned a little bit about the heart and some of the pathways through the heart. So obviously the first thing I want you to do is make sure you know the main parts of the heart. Make sure you know that there's 2 atria, 2 ventricles, okay? What did the right side do? What does the left side do? Where do they go, okay? Also know the major valves. We talked about the valves. So you have the AV valves on either side. You have the tricuspid between the right atrium and the right ventricle. You have the AV valve on the left side, which is known as the bicuspid or mitral valve. Okay, you also have the semilunar valves. The semilunar valves are in between the ventricles and the arteries. And so you have the pulmonary, which leads to the lungs, the pulmonary semilunar valve, which then leads to the pulmonary arteries that lead to the lungs. And then you have the aortic valve, which leads from the ventricle into the aorta. Again, very important valve, getting the blood away from the heart. Okay? Measuring heartbeat with either the ECG, which is the high tech, looking at the electrical impulse, or the pulse, that would be low tech, measuring your heart. So either way, you can see if you're struggling. Sometimes you can feel if you're missing a beat. Sometimes you can even feel it in your chest. And again, this can inform your caregiver of issues of the heart. So looking at those things and figuring out if something's going on there. Okay. Remember, arteries always move away from the heart. Veins always bring blood to the heart. And that's an easy rule to remember. Away from, that's arteries, to the heart or toward the heart, that's the veins. Okay. And then I talked about several cardiovascular diseases, and again, can lead to several medical issues. I'm not expecting you to know all the different diseases. I'm not going to test you on those things. But I think for just general knowledge and keeping your idea, remember, heart disease is the #1 killer in the United States, both in men and women. And so more than likely one of you out there in your lifetime, or maybe in one of your families, are going to experience some of these problems. So it's better to be informed and aware of some of these things so that you can be, live longer and be more, be a lot longer survival than if you just ignored the problem. Okay, so if you have any questions on any of this information, I'd be glad to answer them for you. Again, we looked at the blood in the first lecture and now the heart in the second one. So if you have any questions, please let me know. I'd be happy to answer. I thank you for watching, and I'll see you next time.